principles you're outlining and the legislation that passed in the Senate and didn't come up in the House this last
I think the
session?
Senate passed a good bill, and if the Senate bill would have made it to my desk, I would have signed it. And so I think that they did good work. It was the work that they worked in not only in committee but also on the floor. And I think Senator Root, Senator Smith, Senator Schaefer, and others shaped what I think is an acceptable, affordable bill. And so I don't have any significant criticisms of what the Senate did.
But that Senate bill also required coverage of treatment and ABA up to $55,000. So it sounds like you just outlined the principles of the Senate bill. Is there a difference between what you said and what the Senate bill had?
No, as I said before, I think the Senate bill is good. I think the House obviously was well, it did never come to a vote. But the bottom line is, if we can move a measure with those provisions, I think a couple of pieces that I talked about. Making sure that we protect Missourians from discontinuation of coverage, and looking at the arbitrary cap. Some of those could strengthen it just a tad. But in the world we live in, I don't want in any way, shape, or form to criticize what the Senate did last year, which I think was not only the right thing to do, but I think a thoughtful thing to do. Going through the Senate like that, I think they knew what they were doing. They discussed it in great detail. They took amendments. They made changes to it. And while I do have some things in here that I would hope would be a part of a new bill, the bottom line, I don't want any of that to be seen as a criticism of the strong, courageous, clear, bipartisan vote that the Missouri Senate took last year.
What was the hurdle in the House, and how do you overcome it next year?
I don't think there was any excuse to not vote on this bill on the floor of the House last year. And those would be questions better placed to the people that had control over that. Because clearly the Senate spoke in an overwhelming bipartisan fashion. Clearly the Health Care Policy Committee of the House voted in an overwhelming bipartisan fashion. Clearly the Rules Committee voted in a unanimous fashion to hear this. I think those would be questions better asked to the people that had control of that bill once it left the Rules Committee and did not make it to the floor. Have
you had any conversations with the House Speaker or House leadership on the Republican side, or even the insurance industry, about these principles you outlined today?
We've stayed in constant communication throughout the process with all sorts of people. I have not had specific communications with the Speaker about this. I'm sure we will have that opportunity. We just thought that I thought that it was important to lay down, a specific guidelines as to how this discussion should move forward. I was concerned when he appointed an interim committee, and in the press release appointing an interim committee, he said that he wanted a bill that he was sure everyone would support. Let's not kid ourselves. This is not a bill that everyone is going to support. I mean, the insurance industry will not support this. This is not about trying to find a bill that every insurance lobbyist in Jefferson City is going to sign off on. This is about doing something that's right, correct, proven, and needs to get done. So I felt it was important for all of us, in a very clear fashion, in a bipartisan way, to lay out that this was about moving public policy forward significantly for tens of thousands of families in the state of Missouri, and it was going to require courage, commitment, and that this is not about passing a bill that everybody says, all right, we passed a bill on autism. This is about actually doing something. So, like I say, I was concerned about some of the verbiage when they did that, and based on that, I felt it was important for me and us and our affiliated groups and supporters around the state to clearly lay out at the beginning of this debate what's necessary to make a difference, to get done, and to get signed by me.
Governor, have you heard anything from the federal arena in that health care legislation that they're talking about in Congress that would force insurance companies to cover something like autism?
No, I haven't.
Okay.
Assuming that this would have come up next year, why is it necessary to kind of do this as far as have a presser and push it over the summer?
Well, I mean, we were here last year. All of these people that were here, everyone standing in front of you supports this, and I think overwhelming majorities support this. We want to send a clear message that This isn't just about passing an autism bill, it's about passing the right one that will make a difference. This is a generational time for us. This is the studies, the work that's being done. I mean, especially the reason we kicked it off here at the Thompson Center that merges not only cutting edge treatments, not only that, but also touches the research function here. I mean, this is a unique place here. And so as we have made real and significant progress, it's not dissimilar from the progress that was made in years past on issues involving, for example, mammograms. I mean, 20 years ago, if a woman had breast cancer, she had oftentimes a death sentence. Now, early diagnosis and treatment has thousands and thousands and thousands of women. Same for prostate cancer. The research is in. This is something we can make a fundamental effect on. And I think that Director Huff mentioned also, it makes smart dollar sense. You know, when kids get interacted with quickly, they have a much more significant chance to lead a productive life in which they can lead a productive, independent life. And we are trying to up dramatically the percentage of these young folks that with this early intervention lead productive, independent lives, which means that they will free themselves from the necessity of government or other financial involvement to a significant way. And I thought that the statistics that Director Huff laid out show that this is a long-term net huge savings dollar-wise for us also.
Governor, if somebody makes too much for Medicaid, for example, but can't afford health insurance and has a child with autism, are there already methods available for payment for these treatments to happen? Because if they can't afford insurance, it doesn't seem like this bill would help them very much. So are there already things available for that? Would you want stuff available that would help people like that?
I think there's a lot to be done on healthcare, no doubt about that. And this bill is designed to require that not only the diagnosis, but significant coverage and care and treatment for the insurance policies we have in the state. That obviously in a state where folks don't have insurance, it is a step forward. But also providing this income stream for these treatments will also dramatically expand centers like this one, where literally thousands of Missourians all across the state don't have access to the services that are here right now because, unlike the family behind me, they don't have the dollars to do it. We put this funding source in and expand these services. We'll have more availability of service, but will this solve every problem of every person out there? No, but this is a sea change. 14 other states have done it. They've seen it jump forward. Missouri needs to join that crew and become a leader again.
Is ABA covered under Medicaid?
No, it's not. I don't believe so.
Would you propose to add that coverage too? I mean, that's the state controls that.
Sure. Yep. When we do a mandate, then the state piece is covered.
It's
also
either
under the consolidated for state employees or under Medicaid. We would do that. We're not going to leave out those folks.
Is that something you could do independently of this bill?
I think we need the legislature to do that as a coverage. I mean, I think that they would have to make that change in the law, so we would support that, and it's something that we would work with them to do.
The House Speaker had mentioned that he would not be